Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. Welcome to the Sniff Spotlight Series. Today we are speaking to Kellie Stecher. She is the co-founder of Patient Care Heroes and the governor of the 7th District of the AMWA. Kellie, it's great to have you here.
Thanks so much.
So tell me about your experience in the healthcare space.
So I actually am a full-time clinician right now. I'm an OBGYN, and right now everyone kind of had predicted that we were going to have a little bit of a dry spell with COVID in terms of babies, but our particular practice is quite busy. And so I think that it really depends on where you're at in the country, what the economic hardships were. In Minnesota, we did relatively well. And so we definitely are seeing the baby boom result from that.
So what is Patient Care Heroes and when was that born?
So when I kind of was looking at how things were evolving during COVID, I saw that there was definitely a void that needed to be stepped into, especially for our medical community. When I say our medical community, I mean our CNAs, our nurses, our physicians, our PAs, all of us, right? So anyone who has contact with patients, I feel like there was definitely a void in terms of basically taking care of our population. And physicians notoriously have had a hard time uniting and creating some sort of a voice to advocate for themselves. And we're all very segmented. We all have our different professional organizations. However, that has been relatively ineffective at communicating our needs and being advocates for us. And we really saw that play out with PPE and COVID. And I really felt like us seeing medical students and residents in particular die because we did not have enough PPE for them really was a failure on our part to protect our students. And looking at this and how the community was treated and the morale that was lower than I ever thought it would be, I wanted to create an organization that was a safe haven for people, somewhere that they could come, somewhere they could come to get resources. And this organization was born from that. However, knowing that we had the mental health issues in the medical community before COVID, knowing that we had gender and racial equity issues, the healthcare disparities, I wanted to create something that could pivot and basically be a living organ that people could come and seek out help ongoing. So what we did is we created this organization in order to provide resources for the medical community. And we're focusing right now on the mental health resources because, as you know, that's been the biggest challenge right now. And unfortunately, physicians don't have the access that you would think they do to mental health resources. And if you look at physician licensing, there are questions that actually go against the ADA, the Americans with Disabilities Act, in at least 14 states. And so there is definitely worry and concern for people to reach out to counselors and therapists or to have a diagnosis. And so people don't seek care. And then you see the physician suicide rates and the nursing suicide rates going up. And there was just a study done in JAMA that showed the rate of nursing suicide has gone up substantially, which is not a shock given everything that's happened with COVID. And so we want to be able to basically change policy. We want to be able to participate in the legislation. We also want to be able to provide these resources for free so people don't need to use their insurance and be worried about discrimination on the other side of it.
So you see a huge importance in mental health in the healthcare space. How in particular would you advise caregivers to handle the mental health in the sniff space?
You know, I think the biggest thing is you need to take care of yourself. And someone I used to know would always say, you can't pour from an empty bucket, right? And if you are not taking a moment to take care of yourself, you can't take care of others. And that is really true. And if you look at burnout and depression and anxiety and PTSD and everything else, that's directly correlated to poor patient safety and poor outcomes. And so we really need to look at, as a system, and I mean not just a healthcare system, individual healthcare system, but a medical community, a healthcare system, national healthcare system. We need to look at the culture of medicine, see why it's so toxic, see why people are fearful to come forward and talk about their mental health concerns, see why they don't have access to 24/7 care. We really need to get at the root of this. And I think some of it really stems from medical school and residency and that kind of hazing culture that is still really accepted. And so we need to really get to the core so that we can fix these issues, or we're going to be trapped in this cycle forever.
So what are you doing in order to get to change this cycle and really get into the forefront of the mental health issues?
Yeah. So like I said, on one side, we're going to take care of the innovation stuff, right? So we're going to be offering artificial intelligence through our exopharmaceuticals for depression and substance abuse, specifically alcohol, right? And there's a lot of opportunities there to provide resources for people anonymously so that we don't have to worry about judgment or discrimination, right? We're working with other countries to work on maybe even bringing their resources in. So out of the UK, Guy Outram has an organization, Mindspace 24/7, that we're trying to partner with. Getting around the legal issues with that is the challenge. But through that, then we could have 24/7 access to care for people so that they don't have to worry about discrimination either. So we're trying to put a Band-Aid on it, right? But at the same time, we're hoping to lean on legislation, right? So there's the Breen bill that was put forward by Tim Kaine. And this is a bill that was named after Dr. Breen and the Breen Foundation. Corey Feist is her brother-in-law, I believe. They are advocating for this bill. And it really, the biggest thing it does is offer money, right? And research and time. And unfortunately, there's things that it could be doing that it's not, right? We could have very tangible, concrete items that would very much help people in the culture of medicine, right? If we got rid of non-competes, potentially a healthcare system that is not providing good resources for their employees wouldn't be rewarded with an employee staying there. Maybe they would go to a competitor, right? So I really think that getting rid of non-competes is a critical element to making sure that people are treated fairly. We should be getting rid of mandatory arbitration so that people can have legal recourse if they are harassed or assaulted in the workplace. We should also be able to, advocate for, committees that look at safe reporting structures for women who've been harassed or for people who've been discriminated against. And all of these things should be mandatory. A lot of these things are free to set up, and there should be really no person that is against these things unless they are abusing the system, right? So there's things that we definitely are hoping to implement and we're pushing for, and hopefully we can use these things to help the culture.
So why is mental health so important to you? Like, what made you get into this?
As an OBGYN, women often don't have another physician, right? They don't have a primary care physician. They don't have a psychiatrist. They have us. And so we see them through their whole life. We see them through infertility. We see them through miscarriages. We see them through menopause. And we deal with a lot of the mental health issues. And because let's be honest, all of us will have some sort of issue at some point in our life that we need help with. And so it was just kind of like a marriage that seemed very much to make sense because I'm so used to advocating for women and women in medicine. And so the way I look at it is it's me advocating for the medical community, right? And so I want to make sure that we have access to resources, we can provide people with resources, and we're not discriminating against them based on what their job is.
So we've been fighting this COVID pandemic for over a year now. What impact would you say this has had on mental health?
I think as time has gone on, everyone has become a little bit more burned out, right? I mean, I think people started with a lot of vigor and hope, and then there was the anxiety, right? Everyone kind of got hit with the tidal waves of the different waves of the pandemic. And then there was more hope and, back and forth kind of emotional roller coaster for everybody. And I think when people started openly spreading misinformation, and we needed to kind of fight against the misinformation just to get people to wear masks and to protect each other. That was very challenging for most of us. I never thought in my life physicians would be looked at as liars and spreaders of misinformation, right? Because we were trying to give people the data and the research. And so that's been the most frustrating for me personally. And I can speak for many other people who've also found that frustrating. The biggest issue with that is when you are fighting what seems like a losing battle, that really hits the morale, really ups the burnout. And we're seeing people leave healthcare because they just can't deal with it anymore. And if you look at the information coming out, we're seeing nurses and physicians leaving at an alarming rate. We've always had an issue with the medical culture being somewhat toxic. And so women have always left medicine at a rate higher than you would expect. I mean, 1 in 8 women will leave medicine or go at least part-time before they're 10 years out of residency, which is a huge issue considering we've just invested $200,000 to $300,000, $400,000 in our education. So I really think this is going to have downstream effects that people aren't aware of.
So what resources are currently available for mental health support?
Yeah, so I think a lot of organizations are starting to get behind the need. And if you look at success of mental health resources for the medical community, they need to be easily accessible. They need to be accessible 24/7. They need to not charge, right? I mean, because people really don't invest in themselves if they're struggling financially, especially in an economic downturn during the pandemic. And for example, if you look at healthcare systems, a lot of them have offered EAPs or programs through their systems. Most people will not utilize those because it is their employer, right? There's fear of retaliation if they seek that. Even though there is this claim of anonymity, there is concern that that could be used against them in the future. And that concern in some cases has proved to be true, right? I mean, if you look at some of the states, the southern states especially, there is definitely fear. And so the things that have been the most successful have been organizations that have been separate from healthcare systems or the employer. And again, ones that are free and everything else. So we have created partnerships with Yellow Ribbon Suicide Prevention, with Wellbeing Trust, with the Garrison Institute, with Jonathan Fisher, looking at burnout and how we can work on that. And there's a summit coming up for that. And so what has been the most successful is people being authentic and real and opening up and talking about this and having a dialogue and sharing ideas and then tailoring this to the medical community. And so with that, I really hope that these partnerships will prove successful because we're going to decrease the cost and make it available for everybody.
Would you say that the SNF space and the healthcare professionals there have had more of an impact on their mental health than other medical professionals?
Sadly, I think everyone is really hurting right now. And I don't think it really matters where you're at. If you've been dealing with COVID patients, I think you've been traumatized in some way, shape, or form. And if you came into this already burned out, and then you dealt with that extra trauma, then unfortunately you're going to be a lot higher likelihood of leaving medicine altogether.
So what resources will you need to support your cause?
At this point, we want anyone who has resources, if you have an organization that would like to donate resources, can come forward. So anyone who's working in the mental health space, we're happy to work with you, become partners, put you on the site, make sure that people know that you exist, because that's the number one thing is we want to be sure to connect people to resources that benefit them. But we also want to make this financially okay for people. And so any financial assistance would go directly to us providing care for people, whether that's therapy or that's artificial intelligence. And so that's what any sponsorships would go toward.
Is there anything you can add in regards to specifically the elder care or the skilled nursing home space?
I think we really need to make sure to be protecting our CNAs at that level. So I worked, when I was training to be a CNA, you train in nursing homes. That's where you train, right? And that is a very emotionally draining job, even in the best circumstances, because you're providing care for people, especially dementia patients, who your heart just breaks for them every single day. And you want to make sure that they get the best care and that they're connected with their loved ones and they have the best end of life care. And so it's emotionally taxing. And if I look at why I personally want to make sure that CNAs and nurses have access to mental health care resources for free. It's because of my experience in that area, because I really think anyone who is working in that area, any geriatrician at all, probably had a lot to deal with in terms of just worry and anxiety about their patients and their work environment. So that's the biggest thing. I just want to make sure that we're protecting those people.
Talk to me about artificial intelligence and that presence in mental health, and how does that work?
Yeah, so Orexo Pharmaceuticals has a couple of these apps that we're going to be utilizing, which I think are great. And you log on, you put your information in, like your email, your name. And what's great about that is that's just mine. That's just my stuff. It's not going to go anywhere. It's completely anonymous. And so I don't have to worry about that then being reported somewhere, right? And it's kind of a nice complement to just normal daily life, because you will get text messages, you will get things that remind you of this. You'll be reminded about your wellness and overall well-being, and you can interact with it as much as you want or not at all and just get the text messages. So it's an easy part of your life that you can incorporate at any time.
So how can people connect with you?
So if you want to go to patientcareheroes.com, that is our website. Otherwise, we do have a LinkedIn, Facebook, and Instagram page, and you're more than welcome to connect with us on those. And we can either point you in the right direction for resources, or if you want to be involved in one of our executive committees, either working on advocacy policy change or kind of day-to-day operations, that's fine too. We're happy to have as many hardworking volunteers as possible to make sure that we're supporting our community.
So I also want to go back to another question. What are the 3 key aspects that people can do at home to improve their mental health?
I think that as a physician, there's key aspects that I should be doing that I'm not even doing, right? I mean, say what I do. Yeah, say what I do, not what I, whatever. You know what I mean? So
do what I say, not what I did.
You know what I mean? So I really think that we need to just take time for ourselves, which I know is very challenging, even if it's sitting in your car for 5 minutes, listening to your favorite songs. I know that when I'm transitioning from work to home, that has helped my mental health, because I go from my day job to my job as a mom. And sometimes my job as a mom is equally stressful. And so having like a quick moment where you can kind of hit the reset button on that, I think is really important. Making sure that you are connecting with the outside world, right? Because in the pandemic, in quarantine, we've all become a little detached from our normal support system. And so making sure to talk to your friends, making sure to talk to your parents or your loved ones, I think is really important as well. And honestly, for me, getting the vaccine was really helpful for my mental health, because it decreased my anxiety about getting COVID at work and bringing it home to my kids. So you really have to find which things you're anxious about, right? Is it I'm anxious about my job or losing my job? Is it I'm anxious about my weight, my physical appearance because I've been in quarantine, or whatever it is, and try to do things that are going to help mitigate your anxiety around those issues.
So you wouldn't tell your patients to like turn to alcohol or drugs or, something? No,
I mean, I would prefer them to not have to need my resources more. Yeah. I mean, I think we make light of it, but I mean, really a lot of people have turned to substances to help get through this. And so it's much better if you can, I guess, be like me and be addicted to Diet Coke, I guess. I mean, that's my issue. So I guess whatever you need to do to get yourself through and help your mental health is important.
Kellie, thank you so much for your time. We appreciate the important work you're doing.
Well, thanks for having me. I appreciate it.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight Series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.